Instagram teen accounts have automatic protections for what teens see and who can contact them, plus time management tools. And Instagram will continue adding built-in safety features to help create age-appropriate experiences. Learn more about teen accounts and Instagram's ongoing work to protect teens online at instagram.com/teenaccounts.
Chronic pain is the hidden disability in so many lives.
That age has nothing to do with anything. If you take care of yourself, you'll last longer. If you don't take care of yourself, you'll break down faster. What's the real cause of the problem?
And drains caregivers as well. Dr. William Moyle has spent nearly 40 years proving there's another way.
Because the pain is a byproduct of a problem.
A non-surgical, root-first approach that helps people regain function and dignity without the scalpel.
How single injury can create multiple problems.
Chronic pain is the hidden disability in so many lives. It steals independence, forces people to choose between risky surgeries or a lifetime on drugs, and drains caregivers as well. Dr. William Moyle has spent nearly 40 years proving there's another way, a non-surgical, root-first approach that helps people regain function and dignity without the scalpel. Today, we'll ask him how that works and what it means for individuals living with disabilities, as well as caregivers who stand by them. Dr. Moyle, thank you for hanging out on the Swagability Show with us for a few minutes today. Appreciate your time.
Oh, it's my pleasure. Thanks for having me.
Yes, sir. You've built your reputation around what is called the proven three-step system. For those hearing about this for the first time, myself included, can you kind of walk us through what that really looks like in maybe plain language?
Many people, when they go to a doctor's office or therapist, the first thing that gets handled is what's wrong with you, where do you hurt, and then they try to figure out how to get rid of the pain. The problem with that is it's kind of like if you had a leaky wall and you go to the wall and you paint over it. Okay, you may have hidden it for a while, but the leak is still there. Wouldn't it be better to figure out what's going on, correct that, then paint the wall? Okay, so the first step of my three-step system is to actually discover what is going on. What's the real cause of the problem? Not what the pain is, because the pain is a byproduct of a problem. So, for example, if you didn't have a problem, you wouldn't have pain. The reason you have pain is because you have a problem. Treating the pain is not going to resolve the problem. You need to treat the problem to correct the problem. And so it's kind of a long way around to say, what the heck is going on? We need to figure that out so that we can give you a more permanent solution instead of just treating symptoms and the problem developing further and further. Because within that, there's also a few rules to the body. One, I look at the body as a machine. It's made of parts. Parts break down. Two, we're not getting younger. So the longer we've been around, the more our body has gotten usage, and therefore there could be some breakdowns going on. The third thing is that the body is made of cells. Cells have a lifespan. So for example, you have new skin every 30 days. You have new bones every 3 months, new heart every 4 months. The lining of the stomach is changed every 2 to 3 hours. Your liver every 6 weeks. That's how we heal. There's a process. And so if anything interrupts with that healing process, we don't heal as well, and maybe we don't even recuperate at all. And the problem is that as those cells come up on their lifespan, the next generation is based on what's there before. If what's there before is closer to the master cell, then you have a good reproduction. If there's been damage, then that next set reproduces with damage, and the set after that will have even more damage, and there is a natural degradation to those tissues. Hence, people say, well, what do you expect? I'm old. Has nothing to do with age. I've seen people I had a practice in Boca Raton for a couple of years, and I had patients coming in that played golf and tennis every day. Funny thing is, they were in their 80s and 90s. So it taught me then that age has nothing to do with anything. If you take care of yourself, you'll last longer. If you don't take care of yourself, you'll break down faster.
Is it possible to, you say those cells replicate over time? For someone that's been a chronic pain sufferer for 15, 20 years and those cells have replicated over time, is there a way to get back closer to what that natural once looked like, or for that individual too far gone?
I mean, that's the beauty of the body. The body has the ability to heal itself. Now, obviously, there's also laws within that say that there's a point of no return, meaning that if there's been so much damage, it may not be able to be repairable.
Right.
But if you take a garden, no matter how good or how bad the garden has gotten, if you start to feed it the proper amount of water, the proper amount of sunlight, the proper amount of nutrition, and keep bugs and weeds away, there's a good chance that garden could grow back and flourish again.
Mm.
And that's the beauty of the body is if we can start eating better, drinking better quality water, doing more things that is going to help our system function at a high quality, there's a very big potential that those cells could come back to more natural and more normal, but they may never be 100%.
When a patient comes to you, what typically surprises them the most about your process?
That we get results where other approaches may have failed. That's usually the number one. It's like, I come back home, they didn't do this. So I've gone to other doctors and chiropractors and they didn't do what you just did. And I think a lot of it has to do with logic, common sense, listening to the person. Many years ago, I developed what I call dispersive factor and also patterns of injury. And so both of those explain that when the body is overcome with an injury, it tries to disperse those forces throughout the system. And so with one thing that could start as a sprained ankle, all of a sudden you have knee problems or hip problems or shoulder issues, all because those forces are no longer being transmitted and working properly throughout the body. So as those forces increase, it goes to the next weakest link. And those come into play. And so what happens is, and I wrote an article on this, how single injury can create multiple problems that if we only look at where it hurts, we often miss what the problem is.
I can see that with a spinal cord injury. That makes total sense, like C5 quad, but why is it, unfortunately, narcotics that have to get me through a day? I mean, I'd love to unpack that maybe in a private session, but that's one of those things, right? You focus on there's so many areas that are probably replicated in the wrong pattern, right?
Correct.
Yeah. What kind of assessments or scans help you find the root of or cause of someone's pain? I know, like, obviously, before there's surgery or anything, there's probably investigation done. Are those private that you don't share, or are some of those tactics?
I studied under a gentleman by the name of Dr. John McMillan Manel. He and his father were the fathers of joint manipulation in medicine. They were also the physicians at the Court of England. So very high pedigree. And he taught me that if you listen to the patient, they'll give you the diagnosis, but you get all the credit because you can translate into Latin or Greek and put a name to it, then you look like a hero. But the reality is you need to listen to the patient. They will tell you what's going on. And from there, based on what you've learned in school, based on biomechanics, based on logic and common sense, and that the body is a self-healing organism, when you put all those things together, it creates patterns. And when you can reverse engineer those patterns, you can get that person back to near normal, if not normal.
Just thinking it through it out loud. Does it depend on the severity and how long the pattern's going? But I'm just wondering how soon or how long can it take someone before they start to see meaningful results? Or is that depending on how much replication has gone wrong prior to that treatment?
Yeah, I mean, within the question is always the answer. So yes, it depends on how long it's been going on, but it also depends on, are you looking at where the symptoms are? Are you looking at what potentially could be causing the symptoms, meaning at the root cause?
This episode is brought to you by Indeed. Stop waiting around for the perfect candidate. Instead, use Indeed sponsored jobs to find the right people with the right skills fast. It's a simple way to make sure your listing is the first candidates see. According to Indeed data, sponsored jobs have 4 times more applicants than non-sponsored jobs. So go build your dream team today with Indeed. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
So we know that, for example, people with sciatica, even though their leg is burning, it's not the leg that's the problem. It's usually the nerves that emanates from the spinal cord. And depending on how far down the leg it goes, it kind of gives us an indication of where it may be coming from in the lower spine. Okay. And then we can use tests, orthopedic and neurological tests, to confirm those things and even take an x-ray. Very often before I send somebody for an MRI, I'll take an x-ray. And if it shows indication that the disc space is minimal, that there is pain with it, there are other tests that I call the Moyle compression test that I developed about 13, 14 years ago, that gives me an indication that there's a problem with the disc. Because if the disc was normal, that test would be negative. Whenever it's been positive and I sent someone for an MRI, 99.9% of the time, it came back that they either had a bulging disc or herniated disc. And so when you start looking at patterns, which is really how I started my career many years ago, working with athletes, if I could take an athlete, let's say a quarterback or a right-wing soccer player, they pretty much, no matter who is playing that position, have the same motions. And so we started noticing that certain injuries would come about that. And somebody on the other side, maybe a left-wing soccer player, might have different conditions or different symptoms similar to the right side player, but they were on the left side. And the cool thing about the body is that you have 2 sides. You can always compare one side to the other and see what's different, what's abnormal, and then again reverse engineer and get those areas back to normal range of motion, normal function, flexibility, and mobility.
You've mentioned just athletes there, and I know from reading your biography and just doing a little bit of a deep dive that you've treated hundreds of pro athletes and everyday folks as well. Without using a name, can you share a story or maybe 1 or 2 that really show how this system completely changed life?
Actually, I had a linebacker that came in from one of the big teams, and he had a right shoulder issue. And for over 6 months, they kept treating the shoulder, wasn't getting any better. I mean, they did everything, therapy to cortisone shots, all of that. When he came in, he told me his story, he told me his position, and how he would pretty much have to protect his shoulder now because of the pain. And what I realized, and within 2 minutes of executing a specific move, his shoulder pain disappeared. And so what I realized is that everybody was treating the outside of the shoulder, but the reality, there's a joint called the SC joint, sternocleidomastoid joint, which is right at around the throat where your clavicle is, hooks up to your chest. And very often when that joint gets locked, the shoulder doesn't move. But you try to force it, and obviously playing football, he had to lift weights and things like that. And so when that joint locks, you cannot move your shoulder properly, but most people try to still use it. It overloads the AC joint, the acromioclavicular joint, where the arm is. And as a result, you get all kinds of pain and restriction of motion, inflammation, and then they want to treat that for bursitis and all kinds of other itises, when in reality, that's not where the problem's coming from at all. And so 6 months of pain was taken away in less than 2 minutes by looking at the exact cause, correcting that, and watching his face like, I don't believe this. I've been suffering for 6 months. Why don't they do that over there? It's like, well, it's training, it's philosophy, it's just not accepting that where it hurts is where the problem is. But you have to keep searching. And sometimes I joke that I'm like Sherlock Holmes. I keep going until I find the actual problem and the cause of the problem, and then correct that.
Let's, if you allow me to, talk about that for a minute. Before you've spent 40 years in the industry, what was pre-Dr. William Moyle before you became Dr. William Moyle, and how did you end up in the craft or trade that you now do so well?
I was a immigrant from France. Came here, I was 11 years old, spoke no more than 4 words of English. And then as I started into high school, I remember there was an event that changed, well, a couple events changed my life. But this one, McDonald's had just come out with an apple pie. And so kept hearing about it, got it, and ate it. And then within 15, 20 minutes of getting home, I broke out in a rash. And my dad, who was a master tailor, had a lot of clients. One of them happened to be a medical doctor. So when he got home that night, he called the doctor. Doctor came to the house, gave me a shot, and knocked out the rash within like 10, 15 minutes. But the problem was that he told my dad that I should get off drugs. And I was an athlete, never touched drugs, never smoked, never drank, still don't. And yet that cost me 6 months of my life because my dad believed the doctor over me, and he didn't talk to me for 6 months.
Oh, man.
And so my revenge was I was going to be a medical doctor and never do that kind of stuff. Fast forward, last year of high school, my dad was sponsored so we could immigrate here, and by 3 brothers who owned a clothing store. And one of them took me in under his wing, and he was like a second father. And he said, you know what, if they have short hair, grow your hair long. If they have long hair, cut yours. Whatever it is, do the opposite, and you'll come out all right. And in January of that, my senior year, he was diagnosed with leukemia. By June, he passed away. And he had such an influence on me that I wanted to become a medical doctor, find the cure to leukemia in his honor. And so I started volunteering in a hospital, did that for 3 years, actually worked the emergency room. During that time, I was talked into, look, you have so much passion and you're good at this. Why don't you become an EMT paramedic, and that'll make your road to medical school a lot easier. And so I did that. I ended up doing that for 5 years on top of 3 years in the emergency room. And so I saw a lot of cases and saw a lot of things I wish I had never seen.
I bet.
and saw a lot of the things that were just being covered up by giving people shots and medication, and eventually they'd end up in surgery. I remember one orthopedist said, "You know the difference between a great orthopedist and a bad one?" I said, "They don't do a good job." He said, "No, the bandage." Like, what do you mean? He said, "You could do the best job repairing somebody's broken hand or wrist or whatever, and if you don't bandage it correctly, they think you stink. You could do the worst job, and the bone may never heal, but you bandage it just pretty, and they're going to think you're the best." And so I took that to heart and realized that, you have to be good at your craft, but why not be good and also do the right bandage at the same time?
Yeah.
So you hit both sides of it. And while I was a paramedic, I ended up lifting a stretcher, a patient into the ambulance, and wrenched my back and started suffering from low back pain. Was sent to a chiropractor. My first adjustment, he also adjusted my neck, and my vision improved dramatically. I mean, colors were brighter, everything was crisp. I was like, what the heck does that have to do with my eyes and crack in my neck? And obviously later on, I realized the nervous system has everything to do with everything. And being a paramedic was fun, but when you get calls in the middle of the night for headaches, and first question, how long have you had it? What's well, I've had it 6-8 weeks. And you couldn't have called at 11 o'clock at night or waited till 7. You had to call at 3 in the morning. And so that got old. And decided that since the whole family was in business, I'd start my own business and develop a PVC pipe furniture business. And
Wow.
one day, this doctor came in and we started talking. He says, "Oh, you know a lot about health." And I said, "Well, I studied. I want to do this and that." And he says, "Why don't you come by my office one day?" And I was like, wow, doctor invited me to come by his office. And so I went. I was pretty impressed. And there was a pamphlet in the middle of the rack. I mean, dead center in the middle of the rack. I took that, went home, read it, told my parents, this is what I want to do. And they could see in my eyes that I was dead serious. And they said, okay, we'll support you. I go away to school, graduate, come back. Now the same doctor. There's meetings every first Saturday of the month. And Saturday Night Live, not the show, but this was a chiropractic meeting.
Yeah.
And they wanted to introduce all the recent graduates and tell the story and whatever. So I tell the story about the pamphlet in the middle of the rack. And after the meeting's over, he's like, "William, what are you talking about?" I said, "No, you got to be joking." I don't remember. I said it was a brown piece of paper, a regular piece of paper folded in half. I opened it up. I read that, and it was there. And what was weird is my first quarter in school, our school played rugby against what's called Palmer College of School of Chiropractic, which was the very first chiropractic school.
Yeah.
And since I was there, I'm like, oh, let me go to the bookstore and ask about that pamphlet. They never heard of it. Nobody could recall that. I'm like, okay, this is weird. I had it in my hands. I held it. I read it. I showed it to my parents.
Mm-hmm.
And so what has come across is that I'm not the only one that we didn't choose to be chiropractors. Chiropractic chose us. Because when I recall the events, I start to think, okay, am I misremembering something or what? But I'm not. I know I held that. I know I read it. My parents saw it. I may still even have it somewhere in storage. Who knows? But that's what launched my career. It changed directions. And since then, we've seen over 40,000 patients from 123 countries, thousands of professional Olympic athletes, celebrities, dignitaries. And it's been a fun ride. And if you had told me that at the age of 11, when I couldn't even speak English, that one day I would meet people that I see on TV and be around them and get to break bread with them, I would have told you you're out of your mind. But that's been my life.
That's neat. I appreciate you taking, even taking your lunch hour to come and meet with us. So I'm cognizant of the time. We'll be careful with that. But we've talked about, the present, how you treat it, talked a little bit about your past, but you've spent almost 40 years now around pain management and things. And you've seen how, I'm sure, changes over the years. If you were to look ahead, not that you have the ability to, but where do you see the world of pain management evolving over the next 40 years? Or is it something that won't evolve because it never has? It's just you figured out a better way of treating it.
Well, there are a couple things that are pet peeves. One is nobody should mess with water quality. It should be pure. Nobody should mess with food. No chemicals would be wonderful. Actual homegrown vegetables, fruits, and everything else would be preferred. Fortunately, it's not the case because there's too much money to be made. And so I think that there's two ways it's going to go. One is more with AI and all kinds of things like that give you artificial health and prolonged life. The other is there seems to be a change that people want to do things more naturally without medications, without injections. And so there's a kind of a dichotomy there. And there's going to be probably a clash because obviously, the big companies are making tons of money. And when you look at people buying farmland to create more artificial growth, or artificial beef or artificial chicken, and now they're trying to do artificial fish coming out of a machine, there's a price to pay for all that.
Yeah. Many of my followers will be not just spinal cord injuries. There's MS. There's neurodivergent. There's many disabilities. And for the person that's sitting there listening to us talk, I'm not a skeptic. I know I've been in a chair for over 30 years now after breaking my neck. Talk to them. Talk to me. Is there hope in taking a pain day that's a 7 and an 8 and you don't want to get out of bed, and to getting it down to even a 5 or something that could make your day so that you think and enjoy and you have productivity to life? I know there's those out there. I use work as one of my major things. There's a lot of things I need to work on that maybe our conversation can continue on after, but another time. But talk to those individuals that are out there right now.
Well, you bring up an interesting point because going through school, it was about the expression of life. And so we talked about people that were in wheelchairs or quadriplegic or had lost a limb. And the naive part of us was like, well, how can those people be 100% when they're missing those things?
Yeah.
And the instructor finally got it logically that for them, they can be 100% even with that limitation.
Sure.
Because the expression of matter is still 100%. Okay, there may be blocks here and there, but it's still being expressed at 100%. You may not function at 100%,
right?
But it's still there. And so, it's this probably going to open up a can of worm when you mention MS. But there's a Dr. Brian Hardis ARDIS, on Facebook that has done a lot of research using nicotine. And he's actually said, if I recall correctly, and I may be wrong, but I don't think so, that some of those symptoms from MS can be reversed. Some of the long COVID symptoms within a few days can be reversed using nicotine patch, 2 milligrams. And he's got videos on Facebook, YouTube, all over. So I don't want to take his thunder because of his work. But I've been following him for a while, and he's got some very impressive things. So I would venture to look into that, number one. The other thing, as well as a chiropractor, I do have people with CP and all kinds of other issues that come in, and they do better. They function better. They're a little happier. Am I taking away their problem? I don't think so, but if it can even improve 0.5% because the body is flowing better and functioning better, that's a huge win.
I think you nailed it head on. I don't think anyone listening, or they would be naive. I mean, I once thought at 19 I was going to walk out of the hospital. That was my goal. I mean, 7 years after being physiotherapy every day and whatever, sure, I gained some more movement back maybe, but it wasn't realistic to think after major trauma to the spinal cord that was going to fix itself. But you raise a very good point, is that I wouldn't go to a chiropractor expecting that, but if you could tell me that I could peg an 8 or a 7 or a 6 pain scale down to a 5 or 4, I'd bend over backwards, literally, try and get into whatever practice you had. And so I think in offering hope in the fact that your body, even if it has sustained an injury, there's still a way that it normally can work. And I'm sure we've corrupted it somehow over the years with just trying to not do things not naturally, how it's not naturally meant to move and probably cause pain in many other areas. So I appreciate that, you saying that.
No, I mean, it's just, again, logic and common sense. The body has the ability to heal. If you hadn't suffered that neck injury, your body would be working. So something during that injury affected the function of the rest of the nervous system. Now, if somehow you can reduce some of that stress to the nervous system, who knows what can happen. I know that years ago, and I don't know if it's still going on, in Israel, they were working on exoskeletons that got people out of wheelchairs and walking again with the aid of that.
Yeah, in our local, well, not local, well, our capital city, where the tertiary center is for spinal cord injuries, they have had some studies going on, and exoskeletal is a pretty amazing thing. But again, it's mimicking what your body should naturally do. And when I was rehabbed, like rehabilitation 30 years ago, it was for a quad, find whatever function they have and make that product, give that productivity. So if you had to hook onto the back of your chair in order to hold a fork and not fall over, not realizing that years later, you're having shoulder pain and you've got scoliosis majorly, but there was a big shift right around 1996, 97, where a lady by the name of Mary Bobath and the NDT, natural movement therapy, came in, and it was neat. I got to work with her. She came from England, but and now I see it lived out, because you're talking about that. She was talking about the very same thing. The body has the ability to heal itself, and anyway, it just a complete mind shift in things.
And that's where we need to kind of focus, allow that to take place versus just masking it with medications constantly. Now, nobody wants to be in pain, that's for sure. But sometimes by keeping it masked, you don't allow the system to process itself and overcome things because they're being sedated.
Yeah, and I appreciate you saying that because I'll be the first one to admit I cursed the day that the doctor, sent me home and said, here's what'll help get you through the peak moments because your body obviously is going to develop a tolerance to it. And then you don't know what a peak moment was from the first time you had it to now. Like back then, it could have been a 3, but now it's a 7. Like you lose track of that. And so then your body's got developed a dependency. And, now it's just I would never go down that road. Now, if I could encourage anyone listening, try, definitely not try, but listen to what Dr. Moyle said. Masking is not I wish I'd never started masking. And anyway, I turned a new leaf probably last year, and I'm trying to correct a lot of things. But talking to yourself and Dr. Halero out of Yonkers, New York, we had him on about a month ago, and he said many of what you're saying. I don't want to take much more of your time. You've been really gracious with that. For people that want to get in touch with you or want to find help, we're a nonprofit both in Canada and the US. If they can't travel to you in the US, what should they look for in a doctor or a chiropractor or whatever other names are out there that they can get this sort of treatment that you're talking about?
Oof. Now you're asking for miracles. A lot of the work that I do, I developed myself over the
Okay.
years.
So the idea would be to get you.
Yeah, I would find someone that is very heavy into body mechanics, biomechanics.
How can people get in touch with you? No, that's a great. I mean, that's a great answer. If you haven't got something to look for, I would never want to put words in your mouth. But
Again, biomechanics that works heavily with athletes because he's going to understand function much better, he or she. There's also a gentleman that was one of my instructors many, many moons ago, Dr. Mitch Malley out of Davenport, Iowa, which would be obviously closer to you than I am, down here in Florida. But really, yeah, someone that's heavy into sports and really understands biomechanics.
I think it speaks volumes, though, when you say 120 countries. That says something about the value of your work and the quality of your work. And to me, as a Canadian, I'm always for getting anytime from November until next August. Anytime I can get away from this place, maybe I'll have to take a trip to get physio done. But on the serious side of things, how can people get in touch with you or book an appointment, or do you have a website? We want to put it in our show notes, but also want you to be able to, and if you've got any products as well that you want to talk about.
Probably the easiest is I have a link tree. So it's LINKTR and then period EE / Dr. Moyle, DRMOYAL. So that gives more about me, gives more about the office. There's also an office magazine. There's some other goodies in there that are all no charge.
Great.
That's one way they can get a hold of me. Probably the best way.
Yeah, we'll put your link tree bio in the show notes and also on the screen. They're showing now, so I'll let them in. And before I let you go, last bit of advice when it comes to we've talked about the physical things and all that. You've talked about water and food, but when it comes to diet, are there foods out there that are anti-pain or anti-inflammation like? And if so, what are your recommendations from a nutrition side of things, hands off, if we can't get to you, but that would help at least start our bodies to help heal.
Number one, berries, strawberries, blackberries, raspberries, blueberries. All those things are very good for reducing inflammation. Fresh pineapple that you cut open yourself and eat right there contains bromelain, which also helps to heat up scar tissue. The bromelain is an anti-inflammatory. Overall, really is getting as clean water as possible to drink.
And avoiding what? As always, usually a cat.
I'm not a meat eater, so I don't eat meat. I'm also 67, and unlike many people my age group, I don't get up in the middle of the night 3-4 times to go pee. Just there are a lot of things that, again, I don't eat meat. I don't eat chicken, no turkey, nothing. I do eat seafood. The other thing too is as far as fruits and things like that. I don't know if in Canada they have the same system, but here the fruits have like a 5-digit or 4-digit number on them. Anything that starts with a 4 or 8, no, you want something that starts with a 9. 9 means it's organic, hopefully. The others are either GMO or artificially whatever. But the better the quality of the food. I mean, remember, your body's a machine. If you think of it as a race car, you can't put crappy gas in it and expect it to perform. Okay, so no matter what you have, the better the quality of the food and water that you take in, the better you're going to function, because your body will use that quality to repair itself.
All great advice. And we'll make sure people know how to get in touch with you through your link tree. And thank you for sharing your time, your heart, your expertise with us today. To our listeners, remember, at Swagability, our mission is to help you to thrive wherever life finds you. You could do us the greatest honor by subscribing to our show and commenting, and you would do us the greatest honor by sharing it with someone who we could bring encouragement to today. Until next time, friends, stay safe, stay healthy, stay strong, and thrive wherever life finds you. Swags out.